Well, I don't think a lot's likely to happen in the House this week. You know, we've really failed to move through the process of actually amending these bills, debating these bills, seeing these bills. You know, we're all talking about what's in the bill. The truth is nobody knows what's in the bill because even the bills we've seen immediately get changed. But we continue to reach out. I'm also chairing the Republican Healthcare Solutions Group that includes the ranking member, Joe Barton, who you had on last week from Energy and Commerce, and the leading Republican on the Workforce Committee, the leading Republican on the Budget Committee, the leading Republican on the Ways and Means Committee, trying to be sure that we're just in this debate. And the frustration of this for us has been pretty great. I've never beat on a door harder not to be able to get into the discussion, because I think, and I believe most people in the Congress believe, that this system needs to have some changes in it, and we could have broad agreement on a lot of those changes, and we're down to a couple of big obstacles that we can't seem to figure out how to get them out of the way so we can make the kind of changes that would make the system work better. The worst understanding at all you could possibly have of where I am and where people like me are in the Congress is that there are people in the Congress who don't want to do anything, because that's just not true. This system works pretty well, but it could work better, and access and affordability can both be addressed by other ways than the government coming in and trying to take over the system.
So give us some of your top goals, main points.
Access for everybody, regardless of pre-existing conditions, and that's achievable. We've got the mechanisms in place. In legislation the Republican Congress has passed in the past that needs to be expanded a little bit to make those risk pools work, and other Republican legislation that's out there. So access for everybody, and make the system more affordable. You know, the system has some marketplace dynamics in it right now, but it's not really based on competition. You know, one of the things we did when we added prescription drugs to Medicare is we really, for the first time, the government came in and organized a system rather than tried to operate a system. And that government organized system is much more competitive and has a whole lot more customer satisfaction built into it and price satisfaction than if we'd have just gone in and say, here's what the government's going to pay for and here's what we're going to pay.